A very good evening to all our listeners today. I am Dr. Anjana, your host for this evening. Today we have a very special guest with us, Dr. Danish, who has cleared one of the toughest exams conducted in India by the National Board of Examinations, that is FMGE, in his first attempt. Dr. Danish graduated from Rajshahi University College of Medicine in Bangladesh. He successfully cleared the Foreign Medical Graduates Exam FMGE in the first attempt itself, which is a very commendable job, allowing him to practice medicine in India. He currently holds a provisional registration with the Bihar Council of Medical Registration and is gaining valuable clinical experience through an internship at the Government Medical College, Betaya. So let us welcome our speaker for today, Dr. Danish, who is going to share his invaluable experience of clearing FMG with all of us. So welcome, Dr. Danish. Welcome to this podcast, and thank you for accepting our invitation.
Thanks a lot.
Yeah. So, Dr. Danish, let us start off with your early career. How did you get into MBBS and what drove you into MBBS? So, why did you choose MBBS at the first place?
First of all, thanks a lot for inviting me in your session. And I saw one of your previous session, the Australian Medical Council one, very much randomly. That was a
Yeah.
great session. Congratulations for that. And that
Thank
was so
you.
informative. And I'm looking forward for my session. And I'll say I choose medicine because my father was doctor. And
Okay.
I have no option. Just he suggested, and I was not enough mature to understand all that stuff. If
Hmm.
I'll say bluntly, then it is the correct information. So I just selected because my father was doctor, my two sisters were doctor, two sisters
Hmm.
also doctors. So I selected medicine. No other
Okay.
reason.
Okay.
Yeah.
That's amazing to know that you come from a highly accomplished medical background, and many congratulations to your
Thank
sisters
you.
also who are practicing doctors.
Thanks a
So the
lot.
next question is, you, as I said in the introduction, that you completed your MBBS from Bangladesh, a university in Bangladesh. So how was your experience, studying medicine in a foreign country, and what can you share about, the cultural differences during your stay there?
Look, studying medicine in a foreign country, it is completely a hustle. It is a
Hmm.
hustle and it is challenging. But
Correct.
at the same time, it is rewarding also. And if you'll
Okay.
ask about the challenges, then I'll say you are going to a new country, you are under new laws, culture
Hmm.
is totally different, like new foods. And if you are going to countries, USSR countries, like
Hmm.
Kyrgyzstan, Kazakhstan, you have to experience those extreme weathers, like minus 15 degree, minus 20 degree,
Hmm.
and and that language barriers that sucks for first 6 months.
Hmm.
You are very much unfamiliar to the new language,
Correct.
so for 6 months it is very much difficult, but these are periodic things. You will learn the language in 6 months and then after you will
Hmm.
be okay.
Right.
And but these are some challenges, but I said earlier it is rewarding also.
Hmm.
If you are planning to study medicine in abroad, then it
Hmm.
is damn sure you have not got enough marks in NEET UG to
Hmm.
study in government medical college, and at the
Hmm.
same time you don't have enough budget to study in private medical college too.
Very true. Hmm.
So if any country is providing you a MBBS degree in half of the price what private medical colleges offers in India,
Hmm. Hmm.
we all know the fees of those private college medical colleges of
Very
India.
true.
And
Hmm.
if any country is providing a degree in the half of the marks what Indian government medical colleges offers,
Hmm.
then why not? If you want to be a doctor, then it is a good deal to have.
Right.
And
Right. Very
if you
true.
are
Hmm.
spending, yeah, yeah. And if you are spending 5 or 6 years in a foreign country, then you are going to be much wiser, I guess, more mature, and more empathetic, I guess. And you will
Hmm.
be more tolerant towards the other culture also. That is also very important
Very true.
aspects
Very
of
true.
personality. Yeah.
Hmm. I think there will be an overall development of your personality as an individual
No
when you
doubt, no
go and
doubt,
है ना? So when you go
no.
to a different country and you pursue your studies there, as you said, there is definitely cultural shock when you go there initially. So you
No
require
doubt.
time to adjust to that, and you grow as a personality individually. So
Of
that is a very
course.
valid point that you mentioned. So coming
Yes.
to your MBBS days, so which were your favorite subjects, and which subject didn't you like? So can you just share something on that?
Anjana, all those clinical subjects were very much interesting. those like
Hmm.
medicine, surgery, gynecology. Why? Because you have to interact with patient. There is a lot of doctors
Correct.
patient interaction. So
Hmm.
they were like very much interesting some subjects, but all those preclinical subjects, anatomy, physiology, biochemistry, that was like so
Hmm.
boring, I guess. And one more
Okay.
subject I'll say, pharmacology. Pharmacology is also like those new drugs and all, it's very difficult names, mechanism and all. So
Hmm.
like for earlier days, pharmacology was also like it was not very easy subject to deal with.
Hmm. Right.
Yeah.
Right. Okay, so as you were mentioning, I think pharmacology is one universal subject which all medical graduates, are scared of,
Yeah, yeah,
I
yeah,
would say, because
yeah,
it
yeah,
requires a lot of memorization. And
yeah, yeah.
once
It is.
probably you start enjoying the subject, you will like it more and you will involve yourself more.
Yeah, yeah, yeah.
Right,
It is
yeah.
volatile. It is very volatile subject. Like you forget all
True,
those
true.
names in like minutes.
Hmm.
So
Yeah,
yeah,
I think in that way, even biochemistry is a very volatile subject because you have a lot of cycles to memorize. That also again is very volatile. So you did uh, slight difficulty in the non-clinical subject. That's what you mean to say.
yeah, yeah, yeah,
Yeah,
yeah, yeah.
yeah,
No doubt.
right. Okay. So now let us move to the main topic for today's podcast, that is the FMGE exam. So what is this FMGE exam basically, and who is eligible for this exam?
Look, FMG is a like foreign medical graduate exam. It is a
Correct.
licensing exam which is conducted by NBE. It is an Indian government body. And
Hmm.
after passing this exam, you will be registered as a doctor in India. And
Correct.
so, without passing this exam, with holding of a proper MBBS degree, you are not a doctor. Like
Hmm.
after passing this exam, you will be registered as a doctor in India. So,
Hmm.
like it is the like one of the most valuable exam for FMGs.
Right.
And eligibility will ask then anybody who has done their MBBS from abroad country who want to practice in India have to clear this exam
Hmm.
without any doubt. Then after
Hmm.
they will be registered as a doctor in India. And one more very
Hmm.
important thing, they will be eligible for NEET PG also. Any seat
Hmm.
INI exam for also.
Hmm.
So
Hmm.
like yeah.
Right. So just can you brief us about the application process for this exam?
Yeah, generally NB conduct this exam twice in a year. After
Hmm.
passing your final year, you have to fill an online form from. You have to attach few of the document. They will ask, and your
Right.
proper biometric will be done.
Hmm.
And then after submitting the form, you have to wait. And before 1 week, they'll you have to collect the admit card. Then you
Hmm.
are very much good to go.
Okay. So basically, any medical graduate who has completed his or her education, medical education in a foreign country and who wants to
Yeah.
practice in India will have to clear this FMGE exam,
Yeah, yeah.
right?
One thing I will highlight here because
Huh.
only those university only if you have done your graduation from the country or from the country and
Hmm.
from the university
Hmm.
and the college which is like recognized by NMC, then only
Hmm.
you can give this exam. Because
Huh.
nowadays a lot of agents just
Hmm.
do their like fake admission and all is going a lot, like in
Hmm.
Kyrgyzstan and Kazakhstan, in these two countries.
Okay. Hmm.
Those colleges are not recognized by NMC
Hmm.
after the student is coming and facing a lot of problems. So,
Hmm.
like, you have to do your own research. Anybody who
Hmm.
is going, and you have to
Hmm.
do your own research. You don't rely blindly on those agents.
Hmm.
So,
Right.
like, your university and college must be recognized with NMC.
Right, that's a very valid point because I think all the young graduates who are 12th pass students who are looking for MBBS degrees in foreign countries kindly note this, that you have to make sure that the college and the university you are applying for is recognized by the Medical Council of India, and only then will you be eligible to give the FMG exam and then become a licentiate doctor in India, right?
Of course.
Yes, yes. Okay, so now coming to the preparation part of this exam, how was your preparation? Like, what was your preparation strategy? How did you start with the preparation for this particular exam? I think this is one thing which many of the graduates want to know. This is a question which we get a lot. So, how do you start preparing for this exam?
Yeah, I have done my degree from Bangladesh, and
Right.
like anybody who has graduated his degree from who has graduated from Nepal or Bangladesh, like their university exam is so tough, and you
Hmm.
have to attend all those regular lectures and give regular internal exams. Otherwise, you will not be allowed for the university exam. So
Correct.
follow your professor's note. Their professors are like very much good, and like a proper education. They will conduct a proper education. So like
Okay.
professors note, read the main books, follow the main books, and they'll guide you,
Hmm.
those professors. And you have to do at least 100 MCQ on a daily basis. Check
Hmm.
like FMG previous year questions, NEET PG previous year question. That two thing is very much important. And
Hmm.
highlight the question and topics from where the NB is asking the question. That is also a very
Right.
important thing. And read the topic multiple times. And like anybody who is doing his degree from USSR, Kyrgyzstan, Kazakhstan, Russia, like Philippines, nowadays guys are like very much smart. They generally take Prep Ladder or Marrow. These are online coaching applications, and this is
Hmm.
also a good strategy to complete all those 19 subjects. Like that is
Hmm.
a mammoth thing to do.
Correct.
So, but like you have to do at least 100 MCQ on a daily basis from day one to day last. If you are
Hmm.
doing 100 MCQ 5 year to 6 year, look how much MCQs you have already done. That will be in lakhs, I guess, or 50-70,000.
Hmm.
So like this is the game changer. And
Hmm.
like you will end up with encyclopedia. And if you are not doing previous year question, you are not solving MCQs from different platform, you are not on right track. And
Hmm.
nowadays you various platform you can get those MCQs, like a lot of apps, Prepladder, Marrow, those apps you
Hmm.
can get those MCQs. So my strategy
Hmm.
was that, because like I have not done my graduation from USSR, I have done my graduation from Nepal. And in Nepal and
Hmm.
Bangladesh you'll not get enough time to study from those online coachings, because they'll engage you a lot. You have to do
Hmm.
those ward classes, you have to attend surgeries, you have to be with the medicine, like SR. You have to be with all those professors in their chambers. So like
Right.
you'll not get enough time to study from a different platform. Just blindly follow
Hmm.
them. Their university
Hmm.
exam is so good. They're like they will guide you how to follow the main book. Like
Hmm.
your basics will be like very much up to the mark.
Hmm.
So one thing you have to do is like solve 100 MCQ on a daily basis. You can
Hmm.
join various Telegram pages from
Hmm.
where you can get all those questions. A lot of like good faculties from Marrow, Prep, NLC, Bhatia classes, and they are on Telegram, and
Hmm.
regularly they post the questions. So like solve these questions. Various paid apps are also, like I mentioned earlier, that is
Hmm.
Prepladder, Marrow. So you
Hmm.
have to do at least 100 MCQ daily basis. And and anybody who has completed his final year, now he want to start preparation. Like this is like totally different story. And if
Hmm.
you are in first year, second year, don't bother about preparation. That build up your basics, do MCQs in first year subject, read anatomy, physiology, biochemistry. In second year subject, read second year subject, and solve the revise first year subject also by doing MCQs of first year subject also, and do MCQs from second year also. In
Hmm.
third year also revise first year and second year in the form of doing MCQs.
Right.
Like, yeah, if anybody has completed his degree, now
Hmm.
you have started your preparation. You can opt offline coaching. Gautam Nagar in Delhi is the hub for that.
Hmm.
And you can go and join DAMS, Bhatia
Hmm.
classes, NLC, MIST. These are like very much reputed
Right.
coachings.
Right.
And like if you don't want to go if you don't want to do offline coaching, then you can take Prepladder, Marrow, and you can
Hmm.
read from there. And if you don't have enough time, then it is also a very good strategy. Just take Prepladder or like rapid revision courses, like very
Right. Right.
concise notes. And
Right.
like in DAMS they give you a very concise note. That concise note from DAMS, and you can
Hmm.
read all those theory and one and do your previous year questions. Do 100 MCQs, 200 MCQ, because at last you have to do a lot of MCQs.
Right.
So
So
do MCQs.
yeah.
And I'll mention one book also, that is
Huh.
like FMG Solutions by Deepak Marwa and Dr.
Okay.
Siraj Allama, Dr. Siraj Ahmad. Yeah,
Huh.
you have to do that book at least twice or thrice. You will be
Okay.
very much okay.
Right. So the gist of it is that start early. Don't
Yeah, yeah.
wait for the final year. Starting
Of
off
course.
from the first year, I think it will help you definitely to uh, it will definitely help you to get an edge over somebody who is preparing in the final year, right? So
Yeah,
that
of
will
course, of
definitely
course.
be
No,
help.
no.
Yeah. So we have a question here from Mr. Sohail Aziz. He's
Yeah.
asking how to remain consistent with our preparation. If you can just
Look,
answer that.
I'll
Yeah.
say see the motivational video. No, you are not enough motivated. Like you don't have any option. You have to do.
Hmm.
It is a life. It is a matter of your career.
Right.
So, like, no need to motivation. You must be enough motivated. So you have opt to go a foreign country because you are enough confident.
Hmm.
After coming to the your country, you have to give an exam. This is like
Hmm.
not rocket science. You all know. So
Hmm.
no need of those motivation and all. You must, if you are
Hmm.
not enough motivated, like you are not on right track. Like
Hmm.
it is the matter of your career, and
Hmm.
for this, like motivation is
Yeah.
a very inbuilt thing. Yeah.
Right. Right. Okay. So now moving on, what is the exam pattern, and how many papers does this exam have? If you can just share us on that.
Yeah, yeah, it is a totally MCQ based exam and will be
Hmm.
conducted in two different papers, like
Right.
paper 1 and paper 2. Each
Hmm.
paper will contain 150 questions and you'll get 150 minutes.
Hmm.
And you have to solve those papers in like 150 minutes. And in
Hmm.
paper 1, they will ask all those preclinical and paraclinical subjects. And
Hmm.
in paper 2, they will ask all those clinical subjects, and
Right.
you have to score 150 marks out of 300, means 50%, and there will be
Hmm.
no negative marking.
Okay.
Yeah.
So negative marking is not there. I mean, that is such a big thing to
No, no,
have
no.
because NEET
Yeah, yeah, that is.
PG, that is a
Yeah,
very
yeah,
positive thing, right? Because NEET PG may we
yeah, yeah,
have
yeah,
negative marking, and that reduces
yeah,
your
yeah,
score drastically if you are not sure of your answers. And I think this
yeah,
is
yeah.
one positive thing that we can take from this exam, right? So
Of
that you
course.
mentioned about clinical and non-clinical subjects, do certain subjects have more weightage, and do certain subjects have less weightage? And if you can just share us something on that.
Look, I'll say nowadays, like every subject is important.
Hmm, hmm.
Why? Because they ask integrated question. They will
Correct.
give a gynecology question and they will attach ultrasonography. Now,
Hmm,
Anjana, you will tell this is the question of both
correct.
gynecology as well as radiology.
Radiology,
So
right.
you
Hmm,
don't have to skip any subject. And
hmm,
if you
hmm,
ask about the priority, then I will say, yeah, focus
hmm.
on clinical subject, then paraclinical, then preclinical.
Right,
So
right.
this is the priority. But if you are in a first year, second year, third year, don't bother about these things. And if you
Hmm,
are
hmm,
preparing for that, then
hmm.
yeah, clinical, then paraclinical, then preclinical.
Okay, okay. So, is there any limit for the number of attempts one can take the FMG exam, or any age limit for this particular exam?
Look, till date, there is no such limit, neither on
Hmm,
attempts or nor on the age side.
hmm,
But
hmm,
like soon they can revise. And I was
hmm,
listening a buzz around it, and
hmm.
they can limit 10 years tenure from the first day of your college to the passing
Okay.
FMG.
Hmm.
And if next will come now, there is a
Huh.
lot of buzz about next from
Hmm.
2024. Then whole
Correct,
scenario
correct.
will change. And this rule
Change.
must
Huh.
be this. They will implement this rule, this
Hmm,
10-year rule.
hmm.
But I don't think next will come in 10 year also. This is my point of view
Okay,
because I am listening
okay.
since to 2010 or 2008.
Hmm.
So yeah,
Right.
hopefully they will not like implement this next thing, but who
Okay.
knows?
Yeah, right, right, right. Okay. So, as I mentioned before as well, FMG is exam is one exam which has like a very low pass percentage when compared to other exams that India sees, like for example IIT JEE, or NEET PG, NEET UG, whatever it is, when compared to that, FMGE has very, very less pass percentage. I think it was last year it was around 10%, and the maximum till now has been around 22%. That's like really low score of pass percentage for any exam to be there, right? So what according to you is the reason for this low pass percentage that is seen in FMGE exams?
Look, Anjana, like exam is challenging. This exam is
Hmm.
challenging.
Hmm.
So, like several reasons. Firstly, due to
Huh.
the complexity of the exam, and we
Correct.
ask 19 subject, and
Huh.
it is very difficult to give a exam of 19 subject in a single day.
Correct.
And like you have to be on like for 5 years on a screen.
Hmm.
So like, and one of the main reason is question is also tough. They're asking at like the question is very much up to the NEET PG level. Sometime
Hmm.
they cross even it is more tough than NEET PG.
Right.
And like yeah, and the options are if the question is also they put a very tricky option.
Hmm.
They will ask like which is the most suitable drug, which is the
Hmm.
most suitable, which is what would be your first step.
Hmm.
So these questions are like very much tricky, and generally
Right.
they play with your mind. If you are not
Hmm.
enough calm and composed, then it is difficult. Yeah,
Right.
questions
So
are
I
tough.
questions are definitely tough. I mean, that itself shows why the pass percentage is so low. And as you mentioned, having 17 to 19 subjects and giving it in a span of 5 hours in two
Yeah,
papers, I think we have, as you mentioned, 150 questions each, and you get 1 minute for one question. I think
of
even
course.
when it comes to NEET UG, NEET PG, and I am sure if it is the same for FMG also, that the questions are very lengthy.
Yeah,
First
yeah,
thing
yeah.
is you
Definitely,
have
no
to,
doubt.
yeah. So first thing is you have to read the question. You have to understand and interpret the question. Then you have to come at a conclusion and a diagnosis or a treatment plan for that particular
Yeah,
thing.
yeah,
So I think that definitely takes time. And 1 minute per question will not be enough in such a scenario. And I think that
of
itself makes
course,
it tough, right? So
of
definitely it is
course,
one of
no
the
doubt.
tough exams. Right, right. So you were mentioning about the books that you used for FMG. Can you just emphasize the name of the books again? Which books did you refer for FMG exam?
Look, I'll refer FMG Solutions by Deepak
Uh-huh.
Marwa and Dr. Siraj Ahmad. This is a
Okay.
like very, it is a very good book. Your all
Okay.
previous year questions will be covered. And
Hmm.
I said earlier, if you end up with encyclopedia, if you are not doing previous year question, you are
Hmm.
not doing proper MCQs from different platforms, then you are not on right track.
Right.
And if you are doing online coaching, then from Prep or Marrow, and they'll give their own study
Hmm.
material. They will give
Hmm.
their own notes. And if
Correct.
you'll go to Mist for offline coaching or
Hmm.
any dams and all, they'll also give the study material also. But you have to
Okay.
do that Deepak Marwa book. That is quite good book. And you
Okay.
don't have if you don't have enough time, then you can bet on that book.
Okay, that's really interesting. Okay, so now coming to the next step. Imagine a graduate who has completed his MBBS from a foreign country, has cleared the FMGE exam. So now, what is the next step for that particular candidate? What will be the next step for such medicals who have cleared the FMGE exam?
First of all, celebrate, and like that will be the first step. And go
Right,
and
right, right.
party, hug your parents, and go and meet to all your relatives who doubt
Hmm,
on yourself, and don't say
hmm,
anything because your
hmm.
result is saying everything to
Correct.
everybody.
Hmm,
So be calm and don't
hmm,
like be happy, but don't be enough excited, and be calm and composed and behave like a
hmm,
mature person. You have done something, but you have not done you have like be very much calm and composed, and
hmm.
go and collect your passing certificate from NB
Okay.
office New Delhi, and
Hmm,
then apply for provisional registration in your state medical council.
hmm,
And like then fill a form for internship, and those state medical council will provide this form, and they
hmm,
will conduct a proper counseling. After, on
hmm,
the marks basis, you will get your internship college and go and do your
hmm,
internship. And if you
hmm,
have did your bachelor's from Bangladesh or Nepal, then their
hmm.
internship is valid. and I'll
Hmm.
suggest them, don't come to India for internship, do your internship there. Because
Okay.
like I like I came to India after passing my FMG, but that was not like I I did a mistake. I sometime I feel, because
Okay.
7 or 8 months I wasted. I wasted 7 or 8 months. So
Hmm.
like, if you are doing your degree from Bangladesh or Nepal, do
Hmm.
internship there only. No need to
Hmm.
take NOCs and come to India for internship. And direct
Right.
you can take permanent registration. No need of those provisional registration.
Okay. So, but if it is from a different country, say USSR countries, then definitely they have to do internship here, right? Can you brief on
Yeah,
that?
yeah, you have to do internship. Yeah, you have to do internship in India. If you
Huh.
are doing, especially from those USSR countries or Philippines and all. But
Hmm.
nowadays they can revise. Look, every day they
Hmm.
are like implementing some new rules. They can
Correct.
revise. I have
Hmm.
listened a buzz regarding this also, that
Huh.
you have to go to only those countries whose internship is valid in India. They can also
Okay.
implement this rule. Till now,
Hmm.
it is only a buzz, but
Hmm.
it can be a reality also.
Right. Right. And regarding the internship, so you mentioned that we have to apply, and you will be allotted via the government itself. I mean, you don't have a choice over there, right? That is what you said.
No, no, no. Yeah. It
So can
depends
you
on the
just brief?
state.
Huh. Hmm.
Yeah, it depends on, in West Bengal, Jammu and Kashmir, in UP,
Hmm.
in Delhi, the medical council will like allot your
Right.
college.
Huh.
But in Bihar, it is completely different thing. But like they also in Bihar from 2025, this counseling rule will come.
Okay. So you
Yeah,
finish your exam, you finish your MBBS, then apply, complete your FMG exam, apply for a
yeah,
provisional, and then complete your internship.
in terms of, yeah.
Yeah. So once the internship is done, then you will get your licentiate a certificate here.
Yeah, once internship, then collect your internship certificate and apply for
Hmm.
the permanent registration for PR.
Okay, okay, perfect. So that
Yeah,
is how you complete your licentiate certificate and you can start practicing as a medical graduate here in India, right? So,
of course.
yeah. What about this stipend during internship that you mentioned about internship? So, are these FMG cleared candidates eligible for stipend during internship? How is it?
These stipend things depend on state medical council.
Mm,
Few of my friend doing their internship from Jammu and Kashmir, they said they are
mm,
not being paid. But guys
okay.
from West Bengal, he said he's
Mm,
being paid, and New
mm,
Delhi they are being paid, and I
right.
am from Bihar and I am being paid. But
Okay.
in Bihar nowadays only government medical colleges give stipend to FMG
Right.
interns. But
Okay.
hopefully, from this year, all FMG across India will be paid.
Okay,
Hopefully.
so
Yeah.
that if that rule comes in, then irrespective of whether a government college or private
Yeah.
college, FMG candidates will be paid stipend.
Will be paid. Yeah.
Right, right. Okay, so it is similar to IMGs, that is Indian medical graduates. You will be
Of
paid
course. Yeah.
stipend depending on or not that college is providing, right?
Of course.
Okay.
Yeah.
I also heard that a few countries, graduates from a few countries who have done their MBBS there are exempt from these FMG exams. So, can you just tell us about that? Which countries are those and what?
Yeah, if you have done your bachelor's in medicine from Australia, New
Hmm.
Zealand, Canada,
Hmm.
UK, and USA, then no need of
Okay.
this FMG exam. You are like very much
Okay.
as IMGs. You can come
Okay.
and like provide your all the documents to the state medical council and
Hmm.
get a permanent registration directly.
Okay, so these countries are exempt from FMG exams. They don't have to take it directly. They can
Yeah,
come and apply for licentiate certificates. Okay.
yeah.
Oh, right, right. Speaking of countries, which countries do Indian students prefer to do their MBBS abroad? I mean, what do you feel is the current scenario and current preferences when it comes to countries?
Look, I'll say previously it was Ukraine before the war, but now
Hmm.
like Ukraine is like Ukraine is not a good place to
Hmm.
go for your bachelor's. Like
Huh.
war is still
Right.
going on, and I
Correct.
I
Correct.
guess like government is also not allowing to go to Ukraine.
Hmm. Hmm.
And so like nowadays those USSR countries very much famous destination for the Indian students.
Hmm.
Very less documentation. A
Hmm.
process of admission is very much easy,
Hmm.
and like they will ask very few documents. So yeah,
Okay.
it is very nowadays those USSR country, and cost of living is also very less. So
Hmm.
those are very cheap country.
Hmm.
But my suggestion will be go to the country where like internship is valid. Don't take
Hmm.
risk nowadays.
Hmm.
So to go to the country where internship is valid, go to Nepal, Bangladesh, or there are few colleges in Philippines or
Hmm.
I guess Mauritius also. Their internship
Okay.
is valid. Yeah, yeah, yeah.
Right.
We
I
can go
think
there.
along with this, I would like to emphasize the point that you made previously also, that, also make sure that the university and the college is recognized by the
Of
council
course,
here
of
in
course.
India, because that again is, I think I would like to emphasize again and again, students who are listening to us, please make sure the university and the college where you are applying for your MBBS is valid, so that you don't have any problem. Because once you do it from a non valid university and you come back and try to even apply for FMG, you will not even be eligible to apply for the FMG. So please make sure about that. And definitely, as Dr. Danish mentioned, opt for something which where also your internship will be valid, so that you can finish that and come back and directly apply for the certificates, right? Licensing certificates.
अंजना मैं एक चीज यहाँ मेंशन करूंगा मैं मतलब मेरे कुछ स्टूडेंट्स मुझसे डायरेक्ट वो लोग कांटेक्ट किए थे वो यूएसएसआर
हाँ,
किर्गिस्तान से कर रहे थे डिग्री एजेंट
ओके,
उनको डायरेक्ट ले गया वहां पे और वहां पे वो लोग एमबीबीएस की ये एमडी की डिग्री ही नहीं दे रहे हैं वो लोग
ओके।
ये मेडिसिन की डिग्री नहीं दे रहे हैं वो लोग पब्लिक हेल्थ की डिग्री दे रहे हैं लाइक
ओह!
वो लोग बहुत बहुत डिप्रेस्ड थे और वहां से
हुँ,
आना
हुँ,
चाहते हैं अब देखिए वो
हुँ,
7-8 लाख रुपए वहां जमा कर चुके हैं 3-4 लाख वो अपने कॉस्ट ऑफ लिविंग में
हुँ,
खर्च कर चुके हैं और
हुँ,
सबसे इम्पोर्टेंट वो अपना 2 साल वहां पे दे चुके हैं
हुँ,
लेकिन अभी भी वो
राइट।
जीरो पे खड़े हैं सो
हुँ,
लाइक
तो
यू हैव
हुँ,
टू डू योर ओन रिसर्च
हुँ। आप अपने तरफ से
यू
पहले
कांट रिलाई ऑन एजेंट
कंफर्म। Right, right. Very true. So
या
don't rely blindly on the agent. Definitely they will know it, but आप अपने तरफ से भी confirm करो कि this is the right college for me. This is the right thing, because as Dr. Danish also mentioned, you are spending your life's earnings and your time there. So it has to be worth it, definitely, right? So that definitely, that is one thing which you need to take care of. Okay. Now coming to the job opportunities, how are the job opportunities for FMG cleared candidates? Is it similar to the regular medical graduates in India? Can you just talk about it?
look first of all the if you have cleared the exam like you are
Hmm.
very much as equal as IMGs you have
Right.
the permanent registration and that is the most important thing
Hmm.
okay and like if you are FMG and you
Hmm.
crack NEET PG also and if there is a
Hmm.
IMGs who is from AIMS or Maulana Azad whatever country and if he
Hmm.
did not clear the NEET PG then you says Anjana who is like more deserving of
Correct.
course the guy who has
Hmm.
cleared the NEET PG
Hmm.
so don't bother about that. You have to pass this exam. You are very much as equal as IMGs, and now you are eligible for your PGs and all. So, and
Hmm.
like doctors patient ratio is so pathetic in India. Look the data.
Hmm.
Indian government
Hmm.
need doctors, and India is
Correct.
not fulfilling.
Hmm.
So they need doctors. So if you
Hmm.
have a valid degree and you are registered as a doctor in
Hmm.
India, then it is
Hmm.
okay. It is
Very
very
true.
much
Very
like
true. I
similar
think,
to IMGs.
yeah, yeah. I think also the point is that a lot of the cream of doctors, they want to stay in tier one cities, and they don't want to go to tier two and tier three
Yeah, yeah,
cities.
yeah.
I
Of
think
course, of
lot
course.
of I think if more and more government opportunities open up because of the job
Of
security
course.
and the
Yeah,
pay
yeah, yeah,
scale
yeah.
also, I think people will prefer and go towards tier two and tier three cities, because definitely, as you mentioned, there is a dearth of doctors there. So
Of
definitely
course.
more graduates are needed who can work in those tier two and tier three cities. I think this can be one of the options if there are more medical jobs which open up, right?
Yeah, yeah. Of course.
Yeah. Yeah. Okay. Now coming to your future aspirations, what are your future aspirations? What do you want to do next? Now that you've cleared the FMG, one of the toughest exams in India. So now, what do you want to do next?
My first target is to clear NEET PG and join residency. That is the like my
Okay.
first target. Then my
Okay.
preferred branch would be like medicine. See
Okay.
what happens, and after medicine, fellowship and then research.
Okay, okay. So you are interested towards inclined towards research. That is good to know because
Yeah, yeah, yeah.
not many doctors, nowadays prefer something in research because they all want to be in practice. And research is something I think which lot of medical students and graduates need to take up nowadays because that is one field where a lot of medical graduates are not there. So it's very nice to hear that you're, inclined towards research. And I also got to know that your sister has cleared FMG
Yeah,
examination.
yeah, yeah.
So congratulations to her. So it's really
Thanks a lot.
nice, yeah. So it's really nice knowing that you come from a background of doctors, and then you and your sister both have cleared the FMG exams. And I'm sure definitely, in the future, definitely you will be contributing a lot towards the society. And we look forward to your achievements and your contributions, definitely. So,
Thanks a lot. Thanks a lot.
yeah, yeah. So, coming to the final question here, what suggestion would you give to someone who is preparing for the FMG exam? I'm sure there are a lot of medical graduates who are studying abroad are listening to us or will be listening to this podcast next. So, what message would you like to give to these graduates who are preparing for the FMG exam?
First of all, if you are in first year, second year, third year, don't bother. Just like focus on your year-wise subject. If you're in first year, read first year subject. If you're in a second year, read second year subject, like that. And
Hmm.
yeah, I'll say if you have done your degree, then limit your syllabus and revise multiple times.
Hmm.
Do previous year questions. Solve
Hmm.
FMG solution book by Deepak Marwa and Dr. Siraj
Hmm.
Ahmad. It will cover you all PYQs, previous year
Hmm.
question,
Hmm.
and solve MCQs from different platforms.
Hmm.
And like this will be you are end up with encyclopedia and not doing MCQs. No, this will not work.
Hmm.
You have to do
Hmm.
MCQs. You have to do previous
Hmm.
year question. You have to highlight where the NB is asking the question. And one
Right.
more important thing is like do the PYQs of NEET PG also. Do the
Hmm.
PYQs of INICT exam also.
Hmm.
Then you'll crack this exam. And I know the guy who is preparing for this exam. I know they are going with very tough time. And always
Right.
remember, tough time don't last, but tough people do.
Very
Work hard,
true.
stay
Hmm.
focused, and I swear your each and every sacrifice will pay off. Your each and every
Hmm.
second of hard work will pay off. And
Hmm.
nothing will work unless you do. Consistency is the
Hmm.
key. And like
Right.
look, you can, and definitely you can. Always visualize. You can.
Hmm.
Be
Hmm.
positive. Yeah.
Right. I think here I would like to add a point, positive affirmations that you were mentioning. I think
Yeah.
seeing yourself achieving that, visualizing that helps a lot.
Yeah, yeah, yeah.
And as
A
you
lot, a
mentioned,
lot.
yeah, definitely. So positive affirmations are something which are very powerful. So definitely don't lose hope.
Yeah,
Anybody can do
of
this,
course.
and being consistent, starting early, I think getting that edge, as Dr. Danish also mentioned, you need to start early. I think that will
Of
definitely
course.
give you a edge than a person who is starting in the final year. So start early, be consistent. And previous year question papers, I think this has been some point where which every competitive exam person needs to do,
Yeah,
not
yeah,
just
yeah, yeah.
FME. I think
Of
any
course.
competitive exam, previous year question papers, try to solve them, try to identify which questions or which topics are being repeatedly asked. And I think focusing on those
Of
topics will
course.
definitely help you. And Dr. Danish also mentioned the books that you need to refer to. So I think it has been a wonderful session talking to you, Dr. Danish, and you have shared great
Thanks a lot.
insights.
Thanks a lot.
And yeah, so you have shared great insights with all our viewers today. Thank you. Thank you for being with us
Thanks a
on this
lot.
podcast. It was nice talking to you. Good day, Dr. Danish.
Thanks a lot.
Yeah.